Don't take blood pressure medication before you know this truth. 90% of seniors are using it wrong. Doctor's warning. I'm Dr. Thomas, with 60 years of experience in elderly healthcare. Today, I want to share something important with you. Don't take your blood pressure medication before you know this truth. 90% of seniors are using it incorrectly. Let's begin. Dear friends, if you or a loved one is holding a blood pressure pill in your hand, I advise you to pause for just a moment, because you might be about to do something dangerous. Not because of the pill itself, but because you may not fully understand what you're doing. In Japan, where I live, millions of people over 60 take blood pressure medication daily. There's nothing wrong with that. But according to statistics, up to 63% don't attend regular follow-up appointments. And nearly 30% switch or stop medication on their own just because they feel fine. Do you know what happens after that? Back-end index pointing right. Some collapse in the shower from sudden blood pressure drops. Back-end index pointing right. Some faint in the kitchen and hit their head on a countertop. Back-end index pointing right. Some are perfectly fine in the morning, then rush to the ER at night after cardiac arrest. All because they thought they were taking their medicine correctly, but in fact, were doing it wrong. I'm not here to scare you. I'm here to share a critical truth that sadly, too few people are talking about. I want you to live well. I want your parents to be free from dependency on medication. I want our elders to live long while staying sharp, independent, and able to walk on their own 2 feet. Please, give me just a few precious minutes of your life. Because if you watch this video to the end, you might just save yourself or someone you love. Part 1. Is blood pressure medication really harmless? Have you ever thought about this? Many people think blood pressure meds are like daily vitamins, safe, routine, no big deal. But that's a dangerous misconception. Blood pressure medication is not a candy. It's a double-edged sword. Back-end index pointing right, use it correctly. You live healthier. Back-end index pointing right, use it wrong. Even slightly, you could faint, damage your kidneys, or suffer a silent stroke. So, what are blood pressure medications? They're not all the same. In fact, there are several classes of blood pressure drugs, each with different mechanisms and different side effects. Pushpin common types include ACE inhibitors, relax blood vessels, lower BP, may cause dry cough, high potassium. Each type is prescribed based on your body, medical history, and age. There's no such thing as, this medicine worked for him, so it must work for me. I feel better, let me double the dose. Men's health worker or a cardiologist friend of mine once told me, the medicine isn't dangerous. It's the careless habits around it that silently kill people. Crossmark common mistakes many people make. Reusing old prescriptions without seeing the doctor. Taking meds irregularly. Some days yes, some days no. Stopping meds just because they feel fine. Increasing the dose when they feel dizzy or tired. Mixing with alcohol, supplements, or herbs without asking the doctor. Calcium channel blockers. Slow heart rate, reduce vessel tension. May cause swollen legs, constipation. Diuretics. Help eliminate salt and water, reduce BP. Can cause cramps, fatigue, potassium loss. Beta blockers. Slow heart rate, reduce heart strain. May cause fatigue, cold hands, mild depression. Are you making any of these mistakes? Don't be ashamed. What matters isn't that you made a mistake. It's whether you're willing to correct it in time. Bar chart, a real-world study showed. Elderly people who take blood pressure meds without a doctor's guidance have a 2.5x higher risk of stroke and a 40% higher mortality rate within 5 years. Here's something most people don't tell you. Blood pressure medicine does not cure high blood pressure. It only manages it, like reins holding back a galloping horse. If you let go, the consequences can come quickly and severely. Some ask me, so is it bad to take these pills for life? The answer is, back-end index pointing right if you take them correctly, consistently, and live a healthy lifestyle. The meds will help you live longer and better. Back-end index pointing right, but if you depend on them while taking them wrong, they can slowly harm your body without you noticing. Are you tired of taking pills every day? Are you worried that your body has become dependent on medication? Please remember, it's not the medicine that's scary. What's scary is not understanding what we put in our bodies every day. Once you understand the truth, You'll take control of your health, instead of letting the medicine control your life. The silent dangers of self-medicating. You've probably heard seniors say, "I've been on blood pressure meds for years. It's fine. I'm used to it." Then suddenly, they're rushed to the ER. Severe hypotension, brain injury, irregular heartbeat, stroke risk, all due to one small habit: self-adjusting medication without asking their doctor. Chart-decreasing, dangerous outcomes of improper medication use. Sudden blood pressure drop, taking a double dose, or taking meds at the wrong time can cause sharp drops. Symptoms: dizziness, nausea, cold hands/feet, fainting when standing up. Back-end index pointing right for younger adults. It may be uncomfortable. Back-end index pointing right, but for those 60 plus, a single fall can be fatal. Hip fractures, brain injury, or loss of mobility. Irregular heartbeat or cardiac arrest. Some meds slow heart rate to reduce cardiac strain. Overuse or interaction with other meds can slow it too much or cause arrhythmias. Some seniors experience cardiac arrest during sleep just from misusing beta blockers. Kidney or liver damage. Blood pressure meds are metabolized in the liver and excreted through the kidneys. Long-term misuse without checking organ function can cause irreversible damage. Dangerous drug interactions. Are you also taking diabetes medication, bone supplements, herbal teas, ginseng, reishi, noni root? Mixing Eastern and Western medicine without guidance can increase or block the effects of blood pressure meds. Worst case, it becomes toxic to your liver or disrupts electrolyte balance. Silent stroke. Not all strokes are dramatic. Some only cause mild confusion, temporary weakness, or memory gaps. These are often ignored until the next stroke strikes hard. Broken heart real case. A 72-year-old woman was healthy and active. One day, she felt tired and increased her dose just in case. Next morning, she was unconscious. Diagnosis: stroke due to hypotension. She survived, but never walked normally again. Pushpin 3 quick guidelines. Never change dosage or restart old prescriptions without consulting a doctor. Record daily blood pressure, morning and evening, for 7 days before appointments. Ask the pharmacist if you're taking supplements, herbal teas, or vitamins alongside. Being elderly is not what's dangerous. Being unaware is. The hidden danger behind normal blood pressure. You've heard of 120/80 mmHg, the gold standard. But for people over 60, aiming for 120/80 can be dangerous. Brain why? The elderly need more blood flow to the brain due to vessel aging. Lowering blood pressure too much can cause dizziness, confusion, or falls. Stethoscope, WHO and American Heart Association. Healthy adults under 60, 120 to 129/80 to 85 millimeters of mercury. Over 60, 130 to 139/80 to 89 millimeters of mercury is acceptable. Forcing it below 120 can reduce brain perfusion, leading to mild cognitive impairment, balance issues, in extreme cases, stroke. The obsession with perfect numbers. Many seniors panic when they see 135/85 and take extra pills, or stop meds at 125/78, thinking they're safe. But meds don't regulate one reading. They regulate blood pressure patterns. Old man real case. A 69-year-old man in the UK tried to keep his BP under 120. He monitored 3x daily and took more meds whenever it rose. After 3 months, he fainted in the market. Diagnosis: over-medication. Pushpin, what's your normal? Measure BP right after waking, not after exercise or meals. Track for 7 days straight before deciding on changes. Watch for symptoms: fatigue, dizziness, insomnia. Stable numbers over time matter more than any one reading. Why doctors adjust your medication when you feel fine? Why change my meds if my BP is normal? Why switch from drug A to B? Because medicine is personalized. Doctors adjust based on long-term trends, not one reading. Accompanying symptoms: fatigue, insomnia, swelling. age, and underlying conditions, diabetes, kidney issues. Emerging side effects, cough, leg cramps, slow pulse. You may feel fine, but your heart or kidneys may be struggling silently. Man Health Worker example. A 67-year-old on beta blockers showed stable BP for 3 years. But 1 month, he had fatigue and a 48 BPM heart rate. The doctor lowered the dose to protect his heart. Pushpin, why not self-adjust meds? You lack full clinical data, ECG, liver/kidney function, medical training on drug interactions. A headache may be from dehydration, not high BP. Reducing dosage on your own may cause hidden damage. Why'd have you checkmark follow your doctor's instructions? That's why I don't guess. Keep a BP diary. Never change dose without guidance. A true story. Almost dead from a correct pill taken the wrong way. Mr. Rafin Douter, 68, UK. Fit, walks daily, eats well. Diagnosed with hypertension for 5 years. Took 1 pill every morning. Checked BP every night. But sometimes he forgot a dose. So he thought, taking 2 tomorrow should make up for it. One hot afternoon, he felt dizzy. BP showed 145/90. He panicked and took an extra half pill. 30 minutes later, cold limbs, blurred vision, unresponsive. BP, 90/60ths. Heart nearly stopped. Emergency. Hospitalized for 12 days. He later said, I didn't misuse medicine. I misunderstood it. Exclamation mark lessons. Correct dose at wrong time equals dangerous. Never double dose to compensate missed pills. Panic leads to mistakes. Sit, breathe. Wait 15 minutes, retest. Pushpin if you forget a dose. Take ASAP unless near next dose. If too close, skip it, don't double up. Note the mistake and tell your doctor. One small mistake nearly cost him everything. Top 5 mistakes seniors make with blood pressure meds. Crossmark mistake 1. Stop taking meds because you feel fine. Hypertension is silent. Stopping meds suddenly can cause BP spikes, strokes. Crossmark mistake 2, irregular timing. BP fluctuates naturally. Medication must be consistent. Why'd have you check mark set a fixed time, e.g. 6:30 a.m. Use alarms. Why'd have you check mark take 30 minutes before breakfast for best effect. Crossmark mistake 3, using someone else's prescription. Every person requires a unique dose based on health history. Crossmark mistake 4, skipping follow-ups or home monitoring. Your body changes over time. So should your prescription. Why'd have you check BP twice daily. Revisit doctor every 2 to 3 months. Crossmark mistake 5, mixing meds with supplements/alcohol/herbs. These can block or magnify effects, causing liver toxicity or drops in BP. How to correct your medication safely. Don't panic. Don't suddenly quit. Don't try to detox. Hammer and wrench 5-step recovery plan. Keycap 1, log your current routine for 7 days. Name/dose/time of each med. Meals before/after. Symptoms. Any other pills or supplements. Keycap 2, record BP twice daily, morning/evening. Sit and rest 5 minutes before. Take 2 readings, average them. Keycap 3, visit your doctor. Bring your log and meds. Be honest, even about mistakes. Keycap 4, after med adjustment. Monitor your body daily for 7 to 10 days. Report unusual symptoms ASAP, fatigue, swelling, chest pain. Keycap 5, build a blood pressure lifestyle. Lower salt, avoid sauces, instant noodles, processed foods. Sleep well before 10 p.m. Light exercise daily, 15 to 20 minutes walk. Avoid alcohol and smoking. Practice stress relief, deep breathing, gratitude journaling. Prohibited never. Change meds without doctor. Skip pills to detox. Rely on advice without credentials. Take double doses for missed ones. Obsess over perfect 120/80 readings. Studio microphone, you can reclaim your health. Mistakes don't define you, your actions do. Pushpin summary checklist for end of video. Why'd have you check mark record BP morning and night for 7 days. Why'd have you check mark log all meds doses times symptoms. White heavy checkmark schedule a doctor visit with full info. White heavy checkmark adjust only with medical advice. White heavy checkmark build habits. Low salt, regular sleep, exercise, calm mind.